Welcome here this morning. I'm a slightly last-minute replacement, so apologies if you're expecting Sarah, but unfortunately she couldn't make it today. So I am going to talk a little bit about private wells. So by way of background, I'm sure lots of you know I'm director of the Earth Institute, but you might not know what research or what my sort of research background is. So I did my background's in sort of economics and planning. And when I finished my PhD, I worked in the UK Environment Agency in flood risk management. And then when I got an academic post, my work has sort of stayed focused around, or I've done a lot of work on flood risk, assessing factors that influence behavior related to flood risk mitigation or adaptation. And that moved on to private wells. The focus initially was actually awareness of exposure to flooding of private wells. But then I got into some of the public health elements of that, and then also into septic tanks. So I'll talk a bit more about the private wells. I'll mention septic tanks, but you'll get a bit of a flavour of what it's about. So this particular project, so I'd worked with Paul Hines and Simon Mooney quite a bit over the last few years. Paul Hines is in TU Dublin. And we'd done a piece of work on septic tanks, and then we'd done quite a bit of work on private wells. And then we did a presentation an Earth Institute presentation in the Irish Architectural Archive, I think it was maybe March of 2024. And some people from the Irish Water Forum attended, and we got chatting to them. They were quite interested in what we were doing, and as was the Department of Housing. And we got commissioned, or subsequently, well, we won a tender and got commissioned to do a piece of work on private wells in Ireland and sort of responses to reduce some of the public health impacts. So we've presented this to the Water Forum, to the Department of Housing a couple of times. It's gone nowhere so far, but you'll get a flavour of what it's about anyway. So there's about 180,000 private wells in Ireland. So a private well is, the domestic well. You're not on a public water supply. You are essentially the sole user of this well on your property, and you extract the water from it. That is your consumption for your domestic house. About 16% of the population are half the rural population. So half the rural population drinks essentially unregulated water, or from unregulated water supplies. So once you have a well in, there is no testing unless you test it. There is no regulation unless it's up to you. So STEC, this is the public health context. So STEC is a group of E. coli, previously referred to as VTEC, but STEC is more the European term, but it's a bacterial E. coli. Most strains are harmless and live in the intestines of healthy humans and animals, but the STEC strain produces a powerful toxin that could cause severe illness. Complications are called hemolytic uremic syndrome, or HUS. It can be quite severe, lead to various forms of diarrhea, kidney failure. Ultimately, there's a mortality rate of about 3%, 3 to 5% from people who suffer that. So STEC is highly transmissible, passed from person to person through contaminated food or water or contact with infected animals. Not everyone goes from STEC to developing HUS, but many people, or a portion of people do. Lots of people, when you have undercooked food or drink dirty water, you get diarrhea, upset stomach. That's a precursor. So this is the STEC trend in Ireland. It's been gradually rising over the last 20 years. Some might say it's because we're more aware and testing more. There is a good regime in Ireland in terms of testing for this. It's rising across Europe, but we're amongst the worst. So if you just take Ireland, Germany, and Denmark, that's about 50% of all reported STEC cases in the European Union, just in those three countries. We were the worst until a couple of years ago. Denmark has overtaken us. Now we're, I think, in second place in terms of the notification rate per 100,000 people. When I presented this last year, we were about 10 times the European average in terms of notification, but the trend in Europe has been rising, and Denmark has had a big surge. So we're now about 5 times the European average. But if you take out the big outliers, we have a much higher notification rate in Ireland relative to European norms. So this is us, and this is pretty much the European average, just below 5. It's about 3.5% in the rest of Europe at the moment. We were close to 20. We're now about 17, I think it is. The most recent numbers are just 2023. This is from European or ECDC and the Surveillance Atlas of Infectious Diseases. It's actually quite a good website. There's a lot of data available there. So the people who suffer most are children under 5 and older adults, so over 65. They're the principal groups that suffer the most, perhaps because their immune system are more suppressed. So we may, if you were living in a house that has rural water that is subject to occasional contamination, you may just develop immunity to it over time, so you don't get sick. The problem is, though, if you have a young child or you have an over adult or someone who's immunosuppressed, they may suffer the consequences when there is contamination. So what matters? Private wells are typically untreated and water quality is not monitored on average in most wells. Some people do, but most of the testing is more observation. Does it smell? Does it look bad? But most contaminants are not visible. So just because something is a bit cloudy, that mightn't be the bit of contamination to worry about. It's the E. coli that you should be more concerned about. Settlement pattern with co-located domestic wastewater treatments or septic tanks. So many people who have a wastewater treat or who have a private well also have a septic tank on their property. There's supposed to be a setback distance, but the way the planning system regulates them, there's a setback distance on your site. That doesn't relate to where your neighbor puts their well. So you can put your septic tank on your site here. Downstream is a well here. Downstream, the next door neighbor on a ribbon development. So you're sort of all cross-contaminating potential. And then you may have on the other side of the fence cattle who are, and you get or sort of overland flow into your septic tank or into your private well, through your body, into the septic tank, into your neighbor, and sort of this whole cycle of cross-contamination, potentially in a worst case scenario. So proximity to higher density is a really important factor. And then just the climate change, wetter winters, drier summers, more extreme event, storminess, flooding, there's greater potential for contamination. Drier periods followed by flooding, conditions favouring water source and environmental contamination with microbial pathogens. That's the Department of Agriculture, Food and Marine. If you look at any of the climate adaptation strategies, whether it's Department of Health, Department of Agriculture, climate change, the HSE corporate strategy, whatever strategy you want to look at, they will all mention issues to do with private well contamination and STEC. Problem is, everyone is aware of it, but no single person is actually responsible. And you can throw in the Department of Housing as well. So domestic, this is actually coming from a different project, but I thought it was useful just to give a bit of context. So domestic wastewater treatment system, 75% of Irish households in rural areas use a septic tank or domestic wastewater treatment system. There's a 97% of residences that have a private well also have a septic tank. So that's the co-occurrence of the two. They're relatively under-inspected. About 0.2% of septic tanks are inspected in Ireland per year. So it'd take about 430 years for every septic tank to be inspected once in Ireland under the National Inspection Plan, which was basically a compromise when there was infringement proceedings taken by the European Commission against Ireland for not properly implementing the waste directive concerning septic tank waste. The compromise was we wouldn't get fined anymore if we brought in a national inspection plan. The national inspection plan was initially introduced at 1,000 inspections per year. Now it's 1,200 inspections per year. Half the inspections fail. Of those that fail, 25% are viewed as being hazardous to human health or the environment. And we've more than 500,000 septic tanks in Ireland. So we have a huge volume of septic tanks. And as I mentioned, if you have a private well, you're most likely to have a septic tank on the same site. Yeah, so that project that's actually looking into that at the moment is led by Linda Fox-Rogers. I think Linda may have spoken about that here, but again, it's with Paul Hines as well, and Simon Mooney, and I'm involved in also, and Mark Scott. But that's just a bit of context. So as part of this piece of work we did for the National Water Forum, we looked at, and I'm not going to go into the detail, I'm just pulling a previous slideshow. There's about 40 slides, so I'm not going to go through them all. but we compared the system at play in Ireland versus the system that's implemented in Ontario and Canada. The reason being that Ontario has unlimited free well water testing paid for by Public Health Ontario. We have no free well water testing. If you want to get your test, it probably costs you 150 to 200 euro to get your own well tested by you. And most people get it tested probably when there's something has gone wrong, as it rather than being a preventative kind of approach. Yeah, so I won't go through all that. So what we were doing was looking at all the peer review articles in essentially in English in developed economies on the topic of private well water and its management. So we were looking at, or the focus ultimately was informing what happens in Ireland, but compared with what's going on in Ontario. Obviously, there's a big scale difference between the two, but in terms of Ontario, it has 500,000, so it has 500,000 private wells serving 1.5 million people. Ireland has 180,000 private wells serving 800,000 people. So just in terms of scale, that scale, it's not massively disproportionate. So the key difference is they have free well water testing, they have well driller licensing, bacterial testing during property transactions. They regulate anything where there's over 50 square meters of water per day and more than 5 properties. We only regulate where there's more than 10 square meters or 10 cubic meters of water per day, affecting more than 50 people. We're just using it as a source. So we don't regulate individual houses, essentially, in the main, if you have a private well. So this is studies over time. Most of the studies are the US, Canada, Ireland, and the UK. This pink, or the Ireland, is the green. And that's because it's a big problem in Ireland. There's plenty of areas where it's problematic in the US and Canada, but it's emerging as a big problem because of our reliance on private wells relative to other places. So in the last phase there, we're producing as many papers as they are in Canada and the US on this topic. So there's quite a good cluster of academics looking into this in Ireland. Okay. So just in terms of well testing rates, so previous well testing. So 71% of people of well owners in Ireland have previously undertaken a well test. That possibly might just be when they initially were developing the well. In Canada, it's 89%, Ontario, 90%. Obviously, people can undertake repeat tests, and in Ontario, there's much more repeat testing. I'll talk a little bit about that in a minute. US, about 70%. Annual well testing. So Ontario demonstrate the highest annual well testing rates compared to any other region. Income is a key factor driving well testing in Ireland. And prior test history results significant driver in Ontario and wider Canada. So if you fail the test, you're more likely to repeat a test. So in Canada, 25% undertake annual well testing. In Ireland, it's 8.6%. This is from previous survey work. Ontario, it's nearly 40%. So it's a much higher rate of well testing in Ontario compared to Ireland. And the main difference is it's motivated principally by the capacity to pay in Ireland, whereas it's entirely free in Ontario. So in terms of the differences and key factors in terms of well knowledge, there's relatively equivalent knowledge levels in terms of the survey results between Ireland and Ontario. People had the same degree of knowledge, basic knowledge about the location of the well, key factors influencing its contamination. But the contamination risk knowledge, it wasn't tested necessarily well in survey work in Ontario, but in terms of the Irish response, it was about 60% the level of awareness, and the principal factor informing the level of knowledge was the presence of an infant in the household in an Irish context. In the US, it was more educational attainment in England and income. So it's 83% level of risk awareness in US. So in terms of some of the behavioral attainment on average, well testing about 40% across all the studies. Well treatment about 30%, general maintenance about 60% in terms of general knowledge and intervention impacts. Sorry. So what we did was, I didn't do this, and this is not my expertise, agent-based modeling. So we took all the survey results in Canada, took all the survey results in Ireland, undertook an agent, or we took two primary objectives to demonstrate how input changes would impact private groundwater well testing behaviors. So we produced different scenarios. So completely free well water testing, or maybe one free test, or a free test and a repeat test if there was a fail. Sort of different kind of scenarios combined and put together. Compared the behaviors in Canada, and that if we replicated that Canadian model, how would these results be expected to emerge in an Irish context? So applying the knowledge from the Canadian experience into the Irish experience. That's probably a pretty poor explanation, but that's the gist of it. So the scenarios were incentivize well testing, free well testing, household health risk messaging, domestic wastewater treatment system messaging, an information campaign, adjusting peer influence, regulation, free well water testing and implementation of good risk communication, free well water testing and regulation, and gender-focused messaging. The gender-focused messaging because there is a gender component to some of these. So there's greater awareness and motivation to take action by females on average. There's greater awareness of the location of a septic tank or a well amongst males because they probably were the ones sent out to deal with the contractor when it was being installed in either case. And that does come out in terms of the level of knowledge reported in the surveys. You get different levels of knowledge, but also much higher willingness and motivation to do something amongst female respondents. So what we found was if offering free well testing in Ireland significantly increases testing frequency, moving people into higher testing scenarios. So it's hardly a surprising result. If you implemented the kind of experience that was experienced at the model experienced and implemented in Ontario, you get a much higher, the model suggests there'd be a much higher level of well testing in Ireland. And free testing leads to more frequent well testing with many residents testing multiple times a year. In Ontario, you can test as frequently and on a completely unlimited basis as you want. So there are some people who would test every week. There are some people, I gather, who even test every day. Most people test occasionally if they're concerned, or if they've ran a series of tests over a few months and they're all coming back favorable, then they satisfy themselves in terms of their worry. So what we did then was, how much would it cost to replicate the Canadian model in an Irish context? So how big is this cost if you were to do it here? So we went to a few of the commercial labs to work out, well, how much would it cost to undertake well water testing? So you send in a sample in a little bottle. It's couriered to a lab. Results are processed and you send them back out. Came out at about €32.46 a year ago. So presumably you can probably add a few euro onto that today. So €32 per sample, including transport. So if we went with the Ontario model and we got the same level of testing replicated in Ireland. So the Ontario model is no rules, multiple infinite tests permitted. The only criteria is your address. 85% processing rate. So some models or some samples, when they go in, they have a color, there's turbidity, the water is not testable essentially, or there's inadequate volume of water. 2 labs, one in Dublin, one in Cork. 162,000 samples would be anticipated in year 1. And based on the Canadian experience, the number of samples tends to decrease by about 3% a year. And it would cost about 5.26 million, excluding the cost of administration. So about 5 million, just over 5 million euro would test anyone's private well who wanted it to be tested in rural Ireland in a year, on a no rules kind of basis. The EPA +1 model, we call it the EPA +1 model because the EPA recommends you get tested once a year. So that'd be EPA, one sample per year and one extra sample if there's a positive result. So multiple tests not permitted. Address-based, again, 85% testing or processing rate, 2 labs, 133,000 samples in year 1, sample decreases by 3% a year, 4.35 million euro excluding its cost of administration. Again, sort of an ABM model, no restrictions, multiple tests, address-based, but you must have registered, which adds in a slight different dimension. So that was one of the issues when Ireland first brought in regulation of septic tanks. There was an issue about you had to register, and there was animosity about that. So when you bring in an element of the registration, you might have a slightly different outcome to the completely free-for-all, which was 107, but we're assuming some things here. So 4.48 million. Or a case study model where we just say, we're going to do it in one county as a pilot. And we just picked Offaly. Same kind of thinking, multiple tests, multiple samples, 85% processing rate, 2 labs, 6,000 samples, 200,000 euro. So to pilot it in one county, it'd be about, we'll say, 250,000, including administration costs, to run it in one county and see how it went. And did it make a difference? Did we see less public health impacts and more positive awareness about people's well, and maybe investment in treatment options where that is necessary? So lots of wells where people are concerned or they get results that suggest that they have a problem, there are treatment options. They all cost money, but at least people can make a choice. At the moment, most people are unaware and we'll say overly optimistic about the quality of their drinking water supply. So a few conclusions. There's not really new data that or new data or publications about this that I'm aware of. So cost of gastroenteritis disease in Ireland, including STEC and some other infections, was estimated in 2007, so that's nearly 20 years ago now, by Safe Food, cost about 100 million a year, average cost of about 239 euro per infection. That's known infections. Most people, if they have a bout of gastroenteritis, they don't necessarily do anything. And some of the reported infection rates in Europe are mostly to do with hospitalization. Ireland's a slightly better testing regime, but still there's a high relationship between the level of severity and actually ever being reported and notified. Personal burden and cost per STEC case are very high. About 8% develop HUS, and it's characterized by bloody diarrhea, kidney failure, neurological symptoms with mortality 3 to 5%. I mentioned that already. Australian attribution report, this is more recently, annual cost from 864 cases of illness, 25 sequel illness, 38 hospitalizations, 1 death, estimated at 4.6 million. And that Dutch study, 2011, estimated the cost of each case at 4,132. The more hospitalizations may be recorded in that. Once you get to hospitalization, the costs rocket. If you saw a report this week when they were talking about some of the costs of consultants, the highest paid consultant was about 800,000 euro in Ireland. So with loads of overtime and stepping in. But when you start getting into hospitalization and you start looking at consultant costs, I think the average base salary is 350 grand. So when you get into emergency medicine and hospitalization, that excludes the cost of the infrastructure. Just the salaries are huge. So high social costs. Children and staff are excluded from high-risk settings, including childcare facilities, until they achieve 2 consecutive negative stool samples. Irish study, it took 70 days before 90% of children were clear of infection. 2 clear stool samples. So the social costs and disruption, not really recorded in the health costs, are massive. So anyone who has children here, if you were told you have to wait up to 2 months until you could send your child back into a childcare school setting until they had 2 clear stool samples, that's pretty severe. So Ireland reports an average of 600 to 900 notified cases per year. Reckoning of a colleague is that there could be up to 20,000 cases, but mostly not notified and just dealt with at home, staying at home for a couple of days until it passes off. So over recent years, Ireland's STEC notification rate has been running up to 10 times the EU average. The critical distinguishing factor between Ontario, their rate, 0.78 per 100,000, and Ireland's 17.6 per 100,000 is they offer free well water testing, and we don't. Our modelling suggests that up to 77% of Irish well water users would obtain a free well water test and would cost between 3.5 and 5 million euro to administer. Any questions? We presented this to the Department of Housing twice, different groups in there in the rural water unit. I suspect the principal problem is, well, I know one of the problems is, if you offered a free well water testing program, the first demand of most people would be, if I have a fail or repeat fails, what is the state going to do to help me treat my water? So what's the cost of implementing a national treatment remediation program? But at the moment, people don't know they have dirty water. So anyway.
Thank you very much. I actually retreated our private well for the first time in 60 years this summer. And it was clear, thank God, but it cost us 120 euros. I was just wondering the cost of 36 would be if you...
Bulk.
What?
Bulk, if you're doing bulk,
everything,
bulk
yeah.
testing, yeah.
Okay. So I don't know if we were overcharged or if you go...
No, that'd be...
No, that would be the...
pretty standard for an individual doing it, like probably pretty...
Yeah.
Okay, yeah.
Thank you.
The more kind of options that you test for, the higher the cost go as well. So.
Thank you. It's a very nice presentation. Do you have some data that shows in Ireland how many wells that fails the testing? That
we don't have public data because there is no public testing program. So there's just people undertake private wells, but it's
okay. Even in that, some kind of data, do we have some preliminary data that can show that?
No, not aware of any preliminary data. We have survey data, but a lot of people wouldn't necessarily reveal. Well, that's self-reported. So we have self-reported data on surveys from small samples. We don't have. We have some sampling projects where I think the failure rate was maybe about 15%.
Okay.
Maybe 15-20%. But they're from sort of repeat testing projects with a sample of households that are willing to engage in it. But there's no really nationally representative volume of data.
It's very difficult to know how widespread the issue is now.
Thank you. You mentioned Denmark and Germany at the start of your presentation. Is it also due to private wells that there's a problem with this number of STEC occurrences?
I was looking up why, or what is the suspected reason in Denmark. I didn't get great clarity, but it was more suggesting more food-related contamination. There's also, it can be, people can bring it back from abroad from holidays as well. Ireland had the highest rate of, or one of the highest rates of domestic contamination rather than imported contamination. So I think Denmark, though, I think it's food related.
Okay.
But I'm not gonna guarantee that.
Thank you. Sorry if I missed this, but what is the cost then if the well does test negatively? What's the recourse? What do you do once that
you
happens?
can do sort of a shock treatment where basically disinfect it, or you pour in. My colleague, he spoke about basically large volumes of bleach. Is what some people do. But it's basically disinfectant, shock treatment, a large volume of disinfectant, and then it has to be flushed out. Because that's one thing. Or
that seems pretty bad.
well, if you need to contaminate the well, or you need to disinfect the well, you're going to have to use something to disinfect it. So like it's basically a shock treatment of disinfectant is the gist of it. That's one option. Or you bring in like UV treatment or reverse osmosis. Like there's different treatments depending on the nature of the contamination, but like a UV treatment would be the one that people would, but that costs money obviously to install. Yeah.
Several times and then or you just you try it and then you
well you
test again.
yeah, so you disinfect it, flush it out, and then test again. But you may want to test a few times to be sure. But there are different treatment options, but they cost mostly in the thousands beyond the basic disinfectant kind of option.
Sorry, two small questions, quick questions. First of all, who gathers the data on STEC? Is it the HSE?
Yeah.
Okay. And then has
the public health kind of unit.
Okay. Has the government ever run a public awareness campaign kind of highlighting?
The EPA does occasional pieces on it. There are interested parties in it, but there's no central body that's really responsible for driving a change. So the EPA does well water awareness kind of campaigns.
Okay.
Often related to kind of septic tank awareness pieces. I suppose well water, it's not the only source. So food is another source if you don't cook food. So Safe Food or whatever the new entity, if there's a new one now, they would have done campaigns about appropriately cooking and preparing food to prevent infections as well, or contamination.
So I'd hear about food and you'd hear about septic tanks, but not so much about wells. So yeah. All right.
Well, even from the kind of qualitative focus group kind of stuff that we did as well, there would be a lot of I'd say it's not, the word isn't presumption, but people are very confident about the quality of their water and the quality of the taste of their water compared to the public supplies. And a couple of, like the Galway case of cryptosporidium would have damaged people. People use that as why they shouldn't have to trust the public system because it can fail. And theirs has never let them down, would be one of the kind of attitudes that was prevalent enough amongst a lot of contributors. Others are quite concerned. They're also the type of people that turn up at some of the events as well.
Here to shoot at over in Frank McDermott did some work on public perception.
Yeah.
Quality a couple of years ago, mostly for like urine and stuff. Which might have some interest.
Yeah, Teresa Hooks was involved in that as well.
Right,
yeah.
Do you have access currently to like the, say, spatial heat maps of where these cases arise? And are there links to known, say, groundwater systems that might be at higher risk? And is there some preventative action that could be taken sort of before implementing this program just by warning?
I don't have access to it. I know Paul Hines, I think he did quite a bit of work looking at hotspots of infection. And I know one of the things I believe they found, I just can't recall it specifically, was I think there's from a big flood event, there'd be a time lag, but it could be up to like a couple of months where you get surges of infection. So you can't attribute it all to private wells necessarily, but there certainly would be, there's a time lag between large scale weather events and surges in infection. And there are hotspots around the country. So there are geographical concentrations more in the west than the east, but that might also be to do with their greater concentration or greater access to either, when you have larger populations, you have obviously public water supplies and then group water schemes, which have a higher level of regulation in certain rural areas. So there are groups of householders that combine together and tend to have more, there's more monitoring and treatment options.